Welcome to Fertilish, the podcast where we get real about fertility, infertility, and everything in between. I'm Laura.
And I'm Brandis. And whether you're knee-deep in treatments, just starting to ask questions, or somewhere in the ish of it all, you're in the right place.
Here we ditch the stigma, break down the science, and have candid conversations about the messy, emotional, and sometimes hilarious journey to growing a family and preserving your fertility.
So grab your coffee, your meds, or just your curiosity, and let's get into it. All right. So welcome back to Fertilish Podcast. We're on episode 7 this week.
Yes, I'm super excited to be here. I am excited to talk to everybody today about this elusive fertility thing that Hollywood and the media portrays. I think that they get it wrong so often, and there is just not a lot of reality in the reality TV, or I mean, obviously fictional as well, but when it comes to fertility.
Yeah, and I feel like it's such a big thing, and you hear about it when patients come to, because they're like, oh, well, so-and-so got pregnant at 60 with their own eggs, or, just all these, things you hear, or I know a lot of people, this has come up recently, that people were saying, oh, with IVF you can choose eye color and all that, they're making designer baby.
Yes,
all this stuff is coming out now, and it's like, we are? Because we're not here. Yeah, so misinformation is all over the place.
Yeah, there's not too long ago, I was reading an article about Cameron Diaz, about how she had, I think a second child, but that was, born recently. And, let's just Google how old Cameron Diaz is, because the way that this article made it seem was that she just, had a baby?
Yeah.
She's 52 years old.
Okay, so...
And she just had a baby, very, recently. Let's see.
See, and this is hard, because patients will come for a consult and say, what do you mean it's not going to work with my own eggs, or it may not? Look at, this person who did it, and it's they either had donor egg, they froze eggs from a long time ago, and they're just not... a lot of celebrities, I feel are starting to open that conversation, but so many aren't.
No, I agree. Absolutely. So Cameron Diaz had her first child December of 2019, so not very long ago.
Okay.
And the most recent child was born March of 2024, so last year, a year ago. So at 51 years of age.
See, that's confusing to people, too, and it's not that... And a lot, some people do put their stories out there about, hey, we froze eggs a long time ago, we used donor egg, but so many people don't, and not that because they're in the limelight they have to by any means.
Absolutely, I 100% agree with that.
I think it's important for people to realize that these things happen in the background, and you just don't know. I see Dr. Miami's a big thing on Instagram and TikTok, and he'll post things like when I gave someone a BBL and they post their workout routine to get the best butt. And it's or when I know we've helped someone through IVF for years and it took a long time to, get this outcome, and they'll post about fertility tea and supplements, and it's no, because it gives people this false illusion that all I have to do is these things or buy this program. And that's not at all.
Well, and it's problematic for that reason. And also, I feel that it's problematic because it leads to people, with the age thing. Well, Cameron Diaz had a baby at 51 years old. So now I'm putting it off further and further.
Yeah.
I'm not getting my own self-tested. I'm not checking my hormone levels. I'm not having imaging tests done. My husband or my partner is not having a semen analysis. These things that could be done to let you know where you are personally, but I feel it leads to, it's problematic for that reason, because it allows people to just push it off,
Yeah.
And yes, it could be absolutely possible for you, but let's just just like we go to the RPCP and we are, screened or should be on a regular basis for lots of other things. It should still be a part of the conversation. It still should be part of our medical care. And, we still should be addressing these things, even if Cameron Diaz did have a baby at 51 years old.
Oh, yeah. Well, and you never really get addressed in life about, when you're growing up, it's don't get pregnant. This is, it's a conversation of how to avoid pregnancy. And then you go to your primary care and it's, oh, are you on birth control? Do you want to be on birth control?
Right. It's
And
prevention.
Not one person ever asks you, do you want to have kids someday?
Right.
Let's talk about your ovarian reserve. When do you think you'd want to have kids? But our whole life is geared towards don't get pregnant. And then it's like, oh, how do you get pregnant?
What does a diagnosis
obvious.
of PCOS have to do with your fertility? How does that affect you in the long run? When it's not just let's do this for these symptoms, but how does that affect your fertility as well? What implications could that have on you either now or in the future?
Yeah, well, and a lot of people thought, well, we just thought we'd pull the goalie and try and it would be easy, and I didn't realize that there was only 6 days a month average that this could happen, or I didn't realize, because again, nobody talks to you about it, or I was put on birth control at 15 because my periods were irregular, and no one told me why, whether they were treating PCOS or whatever else to prevent endometrial cancer. And now, I don't even know what my cycles are like. So it's just, it's no one ever really has that conversation. And
it's frustrating.
And, celebrities make it look so easy at any age, and, it's not always reality.
No, absolutely. I love keeping up with the Kardashians or Kardashians, whatever. It's, it's been around for a long time. I think we got used to saying keeping up with, but now it's just Kardashians. Feel like me and Chloe could be besties. She just hasn't had the opportunity to meet me yet and realize it. Whatever. But it was very problematic for me when Courtney, I appreciated her vulnerability when she was sharing how difficult going through IVF was for her, how it was an emotional roller coaster, even though, probably the financial aspect of fertility wasn't a barrier for her. That wasn't probably something that she had to be concerned with, as the average American does.
Yeah.
But I appreciated her vulnerability and how, the emotional toll that it took on her, the physical toll that it took on her. And not that, like you said, not that she owes that to us or anyone. But when she turned around and had a baby, and it was portrayed as if, oh, I just stopped trying and then had a miracle baby. I guess, drink enough matcha tea. I don't know. That, somehow she just, miraculously got pregnant.
Was it her or somebody? My sister loves the Kardashians, and she'll always watch it. And so I'll catch, snippets of it when I'm with her. And it's you get into it. It's interesting, but there was something.
My family
I don't
members
know their
just
names,
go upstairs
though.
if I turn the Kardashians on. My husband and daughter no.
I know Kim, but and Kendall maybe, but the rest of them I get them confused. But one of them was saying that they told her to drink Travis's, her partner's sperm.
That was
to
Courtney.
help her. Okay.
Yep.
And I don't remember.
So this was
might
on
have
her
been one of the
natural
episodes.
okay, so this is after she went through IVF, and then and she's on this natural journey to she's always been a healthy type of you're not going to catch her eating McDonald's, okay? She's always been she's concerned herself with making sure that her kids don't eat candy with certain colored dyes in them or things like that. She's she's been health conscious about what she puts in her body, what her children put in her body. So she kind of already was on that journey and had been for several years. And so when she went through IVF, she was taking, I think, medications that she was uncomfortable with. They were making her feel, kind of some side effects that she was uncomfortable with. And I think that made her additionally, just hyper aware, like, hey, I don't love this journey.
Yeah.
And then, so in the, like, like post IVF, so in the, like, attempt to kind of, like, clean her system back up, and be, like, more natural, there was a lot of, like, kind of maybe what seemingly, I guess, kooky things, that, you know, or maybe they're kooky to some people, whatever.
Yeah.
That kind of, you know, veered outside of, like, the stereotypical, these are the things that I'm doing for fertility.
Well, there was that, and then there was the yoni steaming, which is popular in places.
Yeah.
And one episode I caught with my sister, and then another one, she'll send me, like, TikToks, and she'll be like, is this a thing? Or
Yeah.
what is it? And it's like, oh, what is this? Like, you know, there's so
on
many
Teen
things
Mom,
out there.
I watch Teen. I watch all the things, like all the reality TVs. On Teen Mom, literally, like, in the past few weeks.
Yeah.
Very recently. So there is a girl named Cheyenne that's on Teen Mom, and she has a daughter from a previous relationship. He and his new partner, like, on the show as well. And then her and her, like, current partner, they have a little boy together, and he was, like, had the desire to have another child. She was, like, kind of on the fence about it, for, like, a variety of different reasons. They kind of overcame those obstacles, and then they were like, all right, like, let's start trying to, you know, family plan and look at having our third child. And it wasn't coming nearly as easy to them as they kind of expected. And so, you know, they went to the fertility doctor, and his sperm count was good, but his motility was extremely low. So she was like, all right, like, stop smoking pot. Like,
Yeah.
like, that's enough. And so he did, and then, you know, they were like hopeful, like, okay, like, we'll try to get pregnant. And so she, in an attempt to do that, her and a friend of hers went to do, like, the yoni steaming or whatever, and I can't handle the sauna, so I've, like, not ever been interested. I'm like, no thanks. But I have noticed that, like, a lot of people have, like, been into that. I've not tried it, so I can't personally speak on it. But yeah, I've noticed that's been, like, more of a trend lately.
Mm-hmm.
Vaginal probiotics.
All the natural things. And I think, you know, again, I think it comes from this, like, clean girl Instagram movement of, you know, nobody wants birth control anymore. When, you know, if you have PCOS, you're not getting regular cycles, and you have cells sitting there in the uterus forever, you can get endometrial cancer. And so birth control is a tool we use to treat these things. But now there's this, you know, there's this story on Instagram.
Shed your lining, and
that, you know, hormones are bad. And I think, you know, important to realize natural doesn't always mean good. Too much natural estrogen can cause breast cancer.
Right.
Can cause, you know, so there's a misconception out there for sure that just because it's natural, even people think natural or modified natural embryo transfers are better because there's a word natural in it. And it's just, it's like this whole movement we have now. And so it's just, you know, that's something to manage too in the media, and to manage patients' thought processes on that.
And expectations, like, because, you know, I think that there's a certain expectation that, like, oh, this is going to be better for me because it's, you know, like you said, natural. It has natural in the word, or it has, you know, organic on the bottle, or whatever. What does that even mean?
Yeah.
Like, well, who set the standard, you know?
Yeah, and we've had a lot of people ask too about natural IVF, which you can do without meds, technically, depending on the situation. But it's not as successful. It is going to take probably many, many cycles. So
which becomes more costly.
Yeah.
And you know, it's taking a lot more time, which, you know, for a variety of different reasons, maybe way more cumbersome.
Yeah, so that's kind of the other thing to manage, but I'm trying to think what else is out there in the media that patients bring up a lot.
And not to negate that, like, you know, if for religious or cultural reasons, like, people may want to take
Oh,
less,
yeah.
whatever the thing, whatever it is. Like we want to be like respectful of like your views and if you want to do IVF with no medications, like you can do that at CNY. There are
Yeah.
other clinics that are going to be like, no, that's not an option.
Yeah.
But that is something that like, I mean, I've had many conversations with potential patients like, hey, is this an option here? And that may be why like that they're choosing to come to CNY is because of the accessibility to a variety of different options. And, like we've talked about before, being patient led, but, is it going to yield the same results? Probably not.
Yeah. Is it something you're doing because, yeah, religious reasons or because you think it's as natural so it's better, which isn't always the case.
Right.
And I know you're a big reality. I see articles like some of them are articles, some of them are TikToks, but I see a lot of stuff kind of on those sort of things. I know you are a big reality TV person. What else can you think of that's like out there that, are not necessarily true or different?
Well, one of my all-time favorite shows is Married to Medicine. It's a Bravo
I've never
show.
even heard of it.
So it's an Atlanta-based group. It's either physicians or partners of physicians. So you've got two OBGYNs, female OBGYNs, so them and their husbands. You have you have a dentist, and her husband is, I think he was like in emergency care previously. And anyways, it's a group of physicians or medical related personnel and their partners. So there is a lot of drama behind this particular couple that's on here, but there was a couple, they were married, they got a divorce. The female has new fiance now, she's on the show. Well, the husband, he's a psychiatrist, he has a new wife, and she's on the show. So how they came to be was she had DM'd him. Literally, she had watched the show. She was a fan of the show. She DM'd him, and she was like, hey, like, and he had been very verbal about wanting to have a child. And so she was like, hey, like, I can give you a baby. I'll make a good wife for you. Whatever. I guess he thought she was cute. They started chit-chatting. One thing led to another. Now she's his wife. Well, recently, they have been trying to have a baby. It has come to her attention that she has some fertility-related diagnoses, and they are having difficulty conceiving. So they have, like, been getting ready to do IVF. And I want to punch this man in the face because on a recent episode, she asked him, so, like, what's your timeline for this? Like, how long are you, like, gonna, like, give it a go, or whatever? And essentially he was like, you have 2 years to give me a baby. So, like, if we had control as patients over the timeline, like, we would have probably already had a baby. So I think that that's, like, something that gets portrayed very erroneously in the media, is like whether it's a celebrity, like you hear like, or like let's just say on a reality TV show, like a different reality TV show, like let's say they show this 30-second clip of them like visiting the fertility doctor, and then the next thing that you see is like, oh, they're pregnant, and then they go on to have this healthy live baby, which is a miracle, and like I'm so elated for them. But it just seems like, oh, it happened in this, like, short, sweet little timeline, and they did IVF, so it's a surefire thing. And, like, oh, it seems like it was just, like, oh, super quick, super easy, like, not, no big deal.
That's what I mean. IVF is, like, this abstract thing that people go to a clinic, they go in a lab.
Yeah.
And then come out, and that's it.
Pop a baby out, like, okay.
And it's funny, when I first started here... Or actually, no, I was shadowing. And again, like, you hear about IVF, you read about it, you learn about it, but it's still kind of this abstract thing. You don't really get to see what they're doing in the lab. Like, I could say putting egg and sperm together, and you would have no idea well, you might, but somebody would have no idea what that even looks like.
Yeah.
And so I remember I was sitting out there in the waiting room, and it was just transitioning from a different fertility center to CNY at the time. And there was a sign up that said, technical conceptions, and there was a curtain, and I see all these nurses walking back and forth with IVs, and I'm like, technical conception, what's going on back there? Like, that's so cool. Like, you're making babies back there? Like, what the... So it's just kind of like this abstract thing that people think it's just so easy, and that's really not the case all the time.
Well, and just like putting the sperm and egg together, like, there's so many protocols and standards of care, like SOPs that have to be followed for every single step, like from the moment that like the provider retrieves those eggs and the moment that embryologist takes over those eggs, and how many like steps that there are to even just like clean up those eggs and now count them, and now we're going to perform ICSI. So now like we've had accumulated this collection of sperm, and like now what are we doing to that? Like, what are the processes to even prepare it to be able to perform ICSI? And then now once we have performed ICSI, like what are the steps to be able to now incubate this embryo or fertilized, egg and sperm that have been, they're not even fertilized yet. Like, there's a process for even that, and then allowing them to to grow to become embryos. And like, I think obviously, like, I would love to have one of our embryologists on the podcast at some point, so that they can, give us more insight to that. Because I mean, even to me, being through the process and working for CNY, that is completely elusive to me. Even though I know the steps, like, I don't know the steps. So
well, and there's a misconception too that, like you said, they don't show all the parts. Miscarriages can still happen with IVF.
Absolutely.
Ectopic pregnancies can still happen, even though we're
how
putting
many
the
transfers
embryo
did it take? How many transfers? Absolutely. Like, did they? You're exactly right. Like, did they conceive, but have recurrent pregnancy loss that led to the IVF? Like, all the pain and suffering. Like, how many trips to the therapist did they have? Like, there's a lot behind the scenes that you're not seeing. Absolutely. You're exactly right. Like, so this like 30-second little happy little, oh, it's IVF.
Yeah, Hollywood just makes it look so different.
Right.
Fertility in general.
Absolutely. And, the timeline thing, like, I think it was just super gross to me as her husband that he was like, well, basically you got 2 years to give me a mail. I was just like, you don't get a baby. Like, be quiet.
As if we choose. Like,
like she would have probably already had one. Like, like, this is not a journey that she has to be on either. Like,
and there's so much pressure on women, which male sperm can change too as they age.
Absolutely.
No one ever talks about that as much, but it can. But there's so much pressure on women specifically to, find someone and settle down and pop out babies before 35.
Yeah.
And if you don't, then well, don't you want to be a mom? Or when are you going to start having kids? Or
as if it defines your worth. Like, you're less of a woman because you haven't had a child yet, or you chose not to have a child, or you weren't able to have a child. Like, it doesn't make you any less or more of a human being or of a woman. Like, and yeah, people just really we have a long way to go.
Yeah.
For sure.
Oh, let's see. Anything else you could think of that you watched and thought was out there?
Let's see. I'll have a little list here. I think that it's important to also, like, recognize, like, the access and privilege to fertility care that celebrities have. And so, if you hear of a celebrity that's 49 that just had, like, she's got a 3-year-old, a 2-year-old, and a 1-year-old, and that's all you heard, like, right? Like, you don't know if she did IVF, you don't know if she used donor eggs, you don't know, but, like, also, like, how long did it take to, did she do 24 egg retrievals for 24 months in a row? Like, who knows? Like, how many embryos did it take to
Yeah.
actually get, genetic, how many, or egg retrievals did it take? How many transfers did it take? Like, we have no idea. But the access and the privilege, not only for the affordability of it, like, it's costly to be able to continue to do egg retrievals, to continue to do, embryo transfers, regardless of whether they were with your own eggs or donor eggs.
And with that point, I think a lot of people think, well, this person was way older and was able to conceive. What did they pay for that they were able to use their own eggs, because that person didn't tell the whole story? And I think a good example of that is like Jennifer Aniston. She was like, I did everything.
Yep.
She did an interview, and she was like, I wish someone would have told me to freeze my
Yes.
eggs. But they have money for chefs, for the best clinics, of everything.
Yeah.
And still, it didn't happen, because no matter what technology we have at this point, it can't overcome biology.
Yeah.
And so I think, that's important to recognize as well.
No, you're absolutely right. Like, yeah, I mean, because if it were up to us, every single patient that walked through our doors would have a baby, or however many of them that they want. Like,
I always get patients that say, I want the protocol for the quickest route to pregnancy, and like, I don't want any miscarriages. And I'm like, everyone,
I want that for you too.
You think I was going to give you the protocol with miscarriages? Like, at the longest?
I think you get a few miscarriages.
Like, that's our goal for
Like,
everyone.
no, absolutely. Like, we don't want to see anybody go through that. Like, it's like one of the hardest things that you can go through. Or one of the hardest things I've ever been through. I mean, I've recently, like, I saw how, and I don't know where this comes from, so pardon my ignorance, I'll have to, but how they were equating the grief that comes with infertility and, like, pregnancy loss and things of that nature to a cancer diagnosis. They were equating, like, the grief that, and I'm not saying that either one is more or less than the other. But for me, having gone through my struggles, I haven't been diagnosed with cancer. Like, in that sense, I can't, compare the two, but I could imagine, that, they're both very grief stricken.
Oh, yeah. And I've never, knock on wood, experienced either at this point in my life. But I think, like, even looking at both of those, it's just like a loss of a life you had pictured for yourself. It's a loss of a path that you thought would be easy, or it's a loss of something you thought would be different. And I think that's hard for anyone.
Absolutely. Yeah. Yeah. Like, you're, yeah. And the disappointment, the hurt, the, the pain. I mean, I've even seen people who have, like, let's say they had, transfers, they have a baby, but there's still grief that went through that process. It's not like, oh, it's now like miraculously over, but it didn't happen the way that they, like, dreamt of it happening. Like, yes, they got the baby, and yes, they got the result that they were wanting. But the way, like, their journey to get there was full of a lot of pain and suffering and hurt and disappointment and, loss, like, just like you said. So, even if it happened on the, first transfer, like, there are things that are stolen from you in that process, that, are when the way that, it may have played out in your head that it was going to happen, that wasn't the way it happened. So, yeah, I mean, I think that there's a lot of, grace that we need to give ourselves and each other. And I, like, definitely am a proponent for therapy. I have a standing appointment with my therapist. I think it's just amazing, actually. It's one of the most selfish relationships that you can have. Like, you don't have to go in there and be like, well, how was your day? I mean, it's cordial if you do, obviously, but you don't have to ask about, how's your mom doing? Like, how's your job? Like, whatever. Like, it's about you. They're there to support you, help you. And it's like, it's an hour of your time that's just, like, about you. So, and it really helps you to be able to have some tools to navigate all the ups and downs in life, like, period, regardless of whether it's fertility related or not. So I think it's a great thing.
And I think that's cool. And I think a lot of our patients aside from Hollywood, a lot of our patients, and I know because they'll tag me in things, or we'll share like their journey as they're going, which is brave, because if I'm upset about something, I don't want anyone to know. Like, that's hard.
Mm-hmm.
And to have to like have people reach out and ask questions and to go through things in front of an audience is like not my deal. And so, when these patients do it and then they're on the camera saying we got nothing, and you're kind of going through it with them. I think, that's hard.
Mm-hmm.
And I think you really get to see like the ins and outs of IVF. Like, I don't know if you follow Laura Beverlin on Instagram. She's one of them, but
I always recognize pictures better than I do the names.
Yeah, so she and her husband have been going through IVF forever, and they're young. She has like diminished ovarian reserve, and so just watching them, and I think somebody had even commented like, "Why do you keep posting this when it's just like you're disappointed every time?" And it's like she gave her reasoning behind it, but it's just so you get reality with those.
Yeah, no, absolutely, I agree. And I like not ignorant to the fact that like you can't show all the things on this like one episode, or like you said earlier, like or that we're even owed. Anything more than like what they're willing to share. Well, not owed that either, but like, we're not owed anything as a part of their story. But it just leads to like problematic
expectations.
Exactly.
For sure.
Yeah, absolutely. Let's see. I feel like I have a few more that we could talk about. So yeah, like the Bachelor, Bachelorette, like I feel like that there's a constant like deadline on the contestants that are like in their 30s on like their fertility, but there's like no talk about like egg freezing. There's like no conversation around like what you can do to like circumvent. It's like, oh, like, whew, you're 35 or you're 32, like you're whatever, like what are you talking about? So I feel like there's this like constant conversation about like it's just like this ticking clock, like.
I know. When I first started working here, I remember sitting behind one of the doctors that worked here at the time, watching him do a consult or an egg retrieval and looking at the ages of the people, and it's like, these people are my age. Like, why are they here? And, they list all the reasons, and it's like, okay. And for the first few months, it would like almost stress me out to come to work a little bit, because I'm like, what if I have these problems? Like, what if I struggle and I don't know? And I just turned 30 in March, and it's like, oh, and I have eggs frozen, and it's still like there's
You're hyper aware of
because of my job.
Yeah.
And you have people that are 20 and struggle, so you just never know. But yeah, it makes you hyper aware for sure.
Yeah, and then you have people who like surprisingly get pregnant in their 40s and like weren't even looking to have more children. Like it happened, it can happen. There's always outliers on every, every scenario plausible can happen, right? Like I think it's just important to be aware of your particular situation, because just because it did or didn't happen for this particular person or couple doesn't mean that that's going to be your experience. And I think that like the crux of like today's episode is just like setting realistic expectations. As a clinic, what can we do to educate people more? What can we do to circumvent some of the miseducation that's out there, or misconceptions, and just encourage people to focus on their own individual experience and journey, whatever that may be.
Yeah, I agree, and to not let TV be a thing that you base expectations or fears or anything off of.
Right. It's at the end of the day entertainment.
Yeah. Which it is. And I don't know. I feel like if you guys ever have, questions or stuff about something you see in the news, send it to us, and we can either talk about it on here or on Thursday questions that I do on my Instagram. Because I think it is important to talk about, different things and you know what's true and what's not.
Absolutely. Absolutely. So, just wrapping up another episode of Fertilish Podcast. And don't forget to subscribe, like, follow on all the places that you get your podcast, wherever that may be, Spotify, Apple, Google, YouTube. Like and follow our social media. And if you have any questions, send them to us.
Yeah, we'd love to hear from you guys and kind of include your feedback on the next episodes.
And don't forget to send us your TMI Tuesdays. Any funny, weird, awkward situations that may have ever happened to you while trying to conceive or during fertility treatment. We would love to hear about them.
We'll share them anonymously.
Anonymously.
All right. Well, we will see you guys next week.